Surgical site infections are the commonest nosocomial infection among the patients who are subjected to surgery, and they result in a lot of morbidity and mortality, and of course it increases the length of stay of these patients, and of course in that process it will incur a lot of cost to these patients. So I will ask Dr. Subramaniam that what is the role of surgical mask, as a student, and when we were MBBS and house surgeon, from that time onwards, last 40 years, we are supposed to wear surgical mask, cap, gown, shoe cover. What is really their role? Do they really prevent infection, or they are more helpful to the operator?
Actually, the surgical attire is an important part in preventing surgical infections, because they should be freshly laundered attire. There's a lot of confusion whether the laundering can be done at home or should it be done only in the hospital. But leaving controversies aside, yes, they do play an important role, especially freshly laundered attire is necessary. To prevent squames from the skin which may fall in the surgical field, one needs to ensure that the surgical surgeon's hands are covered. Similarly, if there is a beard, it is advisable that the person wear a full face mask. And of course, gloves are mandatory. But most of this is to protect the surgeon rather than the patient.
So that the surgeon is not exposed to the infected blood.
Correct.
Or anything which comes on the body. So it is for your prevention. So it is really important for an operator to take care for not, of course, for the patient,
yes,
but more for himself.
Definitely, because for example, in a clean person with a clean shaven face, wearing a mask, is it necessary or not? If the person is not going to be talking during procedure where he may contaminate the field, there is still controversy. Studies have shown that probably masks do not contribute, or lack of masks do not contribute to the increased risk of infections. So, but it is a discipline which is involved, and it is, like I said, probably protecting the surgeon as much as probably the patient.
The other thing is, antibiotic prophylaxis is now a recognized modality for for the prevention of surgical site infection. What is the role of a lot of adjunctive measures, like again the same thing, the removal of hair? It has been a common practice, and now you just said that the hair removal leads to more infection.
Right. It's a culture. When we grew up and attended medical school, it used to be the surgeon previous night used to come and say, prepare the area. So dutifully the nurse or whoever would be sitting and shaving the skin the previous night. And studies have shown that removal of hair contributes to increased risk of infection. So if hair removal has to be done, hair removal should be better avoided, but if it is going to interfere with the surgery, it should be done as close to the surgery as possible, and preferably either depilatory cream or clipping is what should be done rather than shaving, which may traumatize the skin, causes microabrasions which can lead to colonization by bacteria.
And what is the role of decolonization, and what are the surgeries where you would recommend that decolonization, particularly of staph, should be done?
Adjunctive measures, like you mentioned, have a role which probably contribute to minimizing the infections. These would include, in certain situations, mainly for cardiothoracic and orthopedic surgeries, checking whether the person's nares are colonized by Staphylococcus aureus, and if they are, to apply mupirocin to decolonize them has a role. It is very important that alcohol or 10% povidone iodine, sometimes a lot of theatres we use 5% povidone iodine, it is not acceptable. 10% or alcohol should be used in cleaning the skin to disinfect the skin.
I think that's the most important, the skin antisepsis.
Yes, and studies have recently shown, there are studies available in the ICU where by bathing the patients with chlorhexidine on a daily basis, we minimize the risk of bacterial infections, CRBSIs, including candidemia also. Like that, it is believed, though we don't have yet enough data, that subjecting the patient to an antiseptic bath for a day or two prior to surgery minimizes the bioburden and probably helps decrease the incidence of infections.
Okay, and there has been talk that we should maintain hypothermia.
Right.
But I think, what is the current recommendation, particularly for the GI surgery? What kind of temperature we should maintain?
I think normothermia is what you should aim at, preferably keeping the temperature over 35.5 degrees centigrade is what should be, should be the goal, because hypothermia can increase the risk of subsequent infections. That should be.
And is there any other precautions in the GI patients?
With regard to GI patients, the only thing we need to keep in mind is when we use antibiotic prophylaxis, it is mainly targeting the gram-positive organisms on the skin. Whereas if you are going to do a clean contaminated procedure which involves intrusion into the gut wall, which is mainly colonized by gram-negatives, you may need to ensure that gram-negative cover is also given to prevent any spilling which can contribute to infection.
So with a little bit of care and your protocolized management, you could really prevent a really preventable infection and decrease not only the length of stay but also the cost of the patient. Thank you.